Hello, I'm Dr. Jasmine Kapoor, Health and Race Officer at Surrey Minority Ethnic Forum.
Hi everyone, my name is Saba. I work for Surrey Minority Ethnic Forum as a physical activities coordinator.
Hi everyone, my name's Claire Burgess and I'm Chief Executive Officer of Surrey Coalition of Disabled People and we coordinate the Independent Mental Health Network.
During 2020, SMEF and the Independent Mental Health Network recognized the disproportionate impact that COVID was having on the mental health of people from BAME groups. We wanted to find out more and to investigate the lived experience of people in Surrey in accessing mental health support. We worked together to design a survey and we then distributed this to our networks online and in paper formats in 6 different languages.
Almost 200 people completed the survey. We set up a steering group with faith and community leaders and SMEF trustees to help provide insight and analysis of the result and form a set of recommendations.
Allow me to guide you through our 12 main findings. Number 1, mental health is still highly stigmatized. Whilst many participants of this survey were able to identify problematic symptoms that they were experiencing, but they were not comfortable labeling them as a mental health need, mental ill health, or mental illness. Number 2, the COVID-19 pandemic has had a detrimental impact on the mental health of over a quarter of participants. 26.5 participants from our survey reported that their mental health has got worse during the pandemic. 24% of participants reported feeling more anxious and 20% reported feeling low in mood. Number 3, faith and community leaders do not know what help and support is available, who is it for, and where can it be accessed. Number 4, awareness of national services, example NHS 111 and the Samaritans, was much better than local offers, example Healthy Surrey, Community Connections, IAPT, or Surrey Talking Therapies. Number 5, poor methods of advertising services and support creates barriers to access services amongst the BAME communities, particularly in terms of translation, a lack of clarity around the cost of services, and the lack of assurances around confidentiality. Number 6, many services are perceived as inaccessible due to lack of translated resources, location of support services, lack of cultural awareness or appropriateness. Number 7, digital exclusion was identified as a barrier to accessing services or support. Digital literacy and confidence were particularly highlighted rather than device access. Number 8, over 45% of participants would rely on the support of friends or family rather than services or support from outside the home or community. Number 9, many carers have not been identified and/or offered a carer's assessment. Number 10, most respondents of our survey had a preference to get support on a one-to-one or single-sex group basis. The preference was for local support in a familiar environment. Number 11, 23% of respondents felt that they would need more information than they currently have about mental health support services before they would consider getting any help. Number 12, community and faith leaders reported a lack of involvement in mental health services and a lack of opportunity to influence what is on offer.
Our insight gathering work and the discussion of the steering group led us to the development of a set of 20 recommendations, and these fall under 5 broad areas of work. Those areas are: number 1, knowledge and understanding of what's on offer and reducing stigma around mental health. Number 2, improving the diversity and quality of services. Number 3, improved identification and support for carers. Number 4, improved accessibility of communications and resources. And finally, number 5, a sustained commitment to co-production with people from Black, Asian and minority ethnic groups. Recommendation number 1. Faith and community leaders should be offered support and training to recognise mental ill health, to tackle stigma, and to understand how to support their communities in seeking help. Recommendation number 2. The system should consider the role of mental health navigator volunteers or champions, perhaps linked to the Time to Change Surrey campaign work. Number 3, navigator support, for example, a guide, training and other resources, should be developed and made available, clearly laying out the offers of support in Surrey. BAME specific services within Surrey and also national bespoke BAME services should be included within this guide. The navigator resources should include the mental health offer in its broadest sense. We heard very clearly the desire for this guide to include complementary therapies and other interventions on offer in the community.
Recommendation number 4. The system should explore the provision of increased choice and provision of support groups, specifically aimed at people from BAME groups working with the existing community and faith groups in operation. Recommendation number 5. Providers should consider increasing the diversity of the physical activity opportunities. Recommendation number 6. The IAP service should be specifically promoted to BAME communities. Faith and community leaders should be given more information about what is on offer from IAP providers. Recommendation number 7. Digital inclusion outreach projects which are being trialed should include a focus around translation apps and developing a training module to teach those who are digitally excluded how to use them.
Recommendation number 8. GPIMs and mix models should be expanded to cover the entire county, and this service should be very well advertised to BAME communities through faith and community leaders. We heard loud and clear that people wanted to be treated in places close to them that they were familiar with. Recommendation number 9. Future planning for peer support groups should focus on locations that are familiar to and easily accessible by people from BAME communities. Recommendation number 10. Health and care professionals should be invited to regularly increase their knowledge and cultural understanding. We would recommend that this work would be best delivered by local faith and community leaders.
Recommendation number 11. Peer support groups for BAME families/carers in providing support to a family member or friend should be set up. Recommendation number 12. The system should set a target for carer assessments done with people from BAME groups and work on carers' communication plan for people from BAME groups to aid carer self-identification and registration. Recommendation number 13. Healthy Surrey's website content should be made available in the most spoken non-English languages in Surrey, such as Nepalese, Bengali, Urdu, Punjabi, and Polish. Recommendation number 14. Communications work should always state that services are confidential.
Recommendation number 15. Promotional material for services should highlight the diversity of the mental health professionals working across the system and within specific services. Recommendation number 16. Promotional material and messages should state that services are free or include their cost for services that are delivered by partners where a small charge occurs. Recommendation number 17. The visibility of communications campaigns should be improved by being linked to special functions like Gurkha Cup football competition, Nepali Mela and Victoria Day function, Diwali and Eid Melas.
And the final 3 recommendations are around the system making a sustained commitment towards co-production. Recommendation number 18. The ICS and all its partners should commit to ongoing co-production with BAME groups and communities. We recommend that providers should be asked to lay out their co-production intentions, specifically with people from BAME groups, and then be held to account for doing so. Recommendation number 19. We recommend that this work, along with the BAME Rapid Needs Assessment that was completed as part of the Community Impact Assessment, is viewed as a starting point, which we need to build on. It's clear that further exploration and understanding is required. Finally, recommendation number 20. We recommend that SMEF, or the Independent Mental Health Network, conduct a survey with BAME communities at regular points in the year to get a more dynamic view of what's working for people and what's not.
To conclude, our work found that the COVID-19 pandemic caused a negative mental health impact for over a quarter of the people involved. The role that the family and wider community plays in maintaining and improving mental health for people from BAME groups was highlighted clearly alongside the barriers that put people off accessing support. Some of the work identified in the recommendations has already started. We have highlighted the need for this work to be viewed as an initial starting point. This conversation needs to carry on. Thank you for listening, and we look forward to working with you to bring the recommendations to life. Thank you.
Thank you.
Thank you very much.